Hi, I'm here with Greg Kelley, M&A for the Jacques Cartier riding. Greg, before we go, how are you?
I'm doing all right, Rhonda. Working from home like most people right now, and of course, just hoping we get through this together. Quite proud of a lot of people out there for stepping up to the occasion right now. All of our healthcare workers, essential service workers. I mean, there's a lot of good spirit going around, which is good, and we're going to continue to need that. So I'm doing as best as I can, like everyone else.
I'm glad to hear it. I'm glad you're home safe and sound. I want you, just before we start, to describe the riding so that those who are not used to the terminology, what is it included in your riding?
Doc Cartier, my riding includes municipalities, Point Claire, Beaconsfield, Baie-D'Urfé, St. Anne de Bellevue, and Centerville. Those municipalities are all in my riding.
Okay, so these people are under your jurisdiction. So when we're talking about this, keep that in mind, everybody. Even though Greg's in Quebec, he is responsible for our little district in the southern West Island.
Absolutely, and like with my other colleagues, Monsef Deraji, Carlos Etao, and Enrico Ciccone, I mean, the West Island, we might have borders, but we share so many common services. So even for your listeners out in Pierrefonds, Kirkland, you know, we're all available and ready to answer any questions you guys ever have. So never hesitate to reach out to any of us.
I'm reaching. I have questions.
Okay, go for it.
Okay, let's start. Okay, we covered how are you coping. Can you explain the shortage of medical supplies when there are, in fact, West Islanders that have supplies to meet the supply chain?
I honestly, at this point in time, can't answer the question. And I was surprised, like a lot of Quebecers yesterday. I want to be very clear. Right now is not the time for politics. I think Mr. Legault has done a very good job of managing the situation, but I was surprised yesterday when he said there's only 3 to 7 days left of medical equipment. When the week before, it sounded as if we had millions of masks and other piece of equipment coming into the province. So hopefully today at 1 o'clock, we'll find out a little bit more about what's going on with the supply chains. Are some of the supplies being held up in another country for some reason? I mean, I really don't know. I'm sure there's an explanation, but it is worrying because I've heard from nurses and doctors now for over a week that this was coming. And I was under the impression that, you know, there were going to be new supplies coming in quickly. Like you mentioned, I've had a few people message me directly saying, we have masks, we have access to masks. What do we do? We've been sending those people the information to the federal and provincial procurement process. But after that, I mean, the follow-up is very much on the government side. So I know that they're aware of the crisis, and I really hope that equipment is found extremely quickly, and we're able to get our nurses, doctors, paramedics, orderlies, the masks and gloves and gowns they need. And I'm just, again, like everyone else, of course, following the situation closely, but I'm really hoping that we get more clarity today from the government on what exactly has gone on and whether or not they're answering the call from so many people who want to either donate or have access to lots of masks they can sell to the government. So I wish I had something that was more precise for the listeners, but that's honestly where we are right now. And it's a huge crisis.
That crisis, I want to be clear to people out there that there is not a shortage of the actual product. The supply chain is blocking it. I know of several, including my husband, who is a certified supplier, that has access to masks, gowns, gloves, whatever, and we're not getting through. We're just not getting through. So don't think out there that there aren't any. It's going to be unclogged, is what's going to happen.
It has to be unclogged at the federal level. Then I hope the federal government just gets it done. If it's even something within the provincial level, again, I just hope it gets done quickly. And I have no doubt that they're trying to make it work because nobody wants to be sending our healthcare professionals across the country into harm's way. And, you know, I've been saying this quite a bit, Rhonda. We can manufacture here in-house in our country more masks, gloves. We can do all that, but we can't make new nurses, doctors, and paramedics tomorrow. And we have to protect those people on the front lines. It is a limited resource we have, our professionals. And if we're going to keep talking about how we're an army of 8.5 million and that we're all in this together, well, we have to make sure the people that are really on the front lines have everything they need to fight the battles that to keep people healthy and you know, to keep us out of the hospitals. So that's something for sure. Look, and we've been mentioning it. We are the opposition, but we're working closely with the government. We've let them know this. It's not like they're ignoring it. And I just hope a solution comes really fast.
Okay, and I agree. Okay. What's the status at the Lakeshore General Hospital right now?
As far as I know, and last time we spoke, the situation, they're prepared, right? They're still not one of the hospitals that is being used to treat patients, but they have created space by opening up some surgery rooms and some floors to make sure that if there ever is an influx of COVID patients and the hospitals that are right now really treating the patients, that they could do overflow. So they have prepared plans for that. But as far as I know, the Lakeshore is still operating fine, and they're waiting and they're prepared. But like everyone else, I mean, the healthcare system right now has an issue. It's not just here in Montreal. The question of masks, gloves, it's province-wide, so they're for sure in the same boat as everyone else, that they need equipment like everyone else.
Okay. I know they had ordered at the early stages, they had ordered a couple of hundred beds and some tents for outside triage and so on. So far they're not up and running, but that's available. The Lakeshore Hospital is ready.
Yeah, and they I mean, now it's to the point where there was preparedness plans. The last time we spoke many weeks ago, it feels like years ago almost, but there, of course, the system is very well organized at this point in time for how they're triaging and where they're moving COVID-19 patients. So at least for now, and what the numbers we have in terms of ICU units and beds available, it's all being monitored very closely as people do need to be hospitalized.
Okay. What about Beaconsfield testing clinics, the screening clinics? What's going on over there?
I mean, again, it's one of the many clinics that were rolled out across the province to increase the amount of testing we have. It is in part reason why we've seen a sharp increase here in Quebec in the number of cases we have, because we have more people being tested. Ontario's numbers spiked quite a bit today too, because they've been testing more. So again, it's good to have a clinic like that in our neck of the woods, just because it does allow the system to test more people, and we have a better idea of how widespread the virus is. So that's again, it's a good thing that we have the clinic there, and the health system really did a good inventory of all the facilities that exist in the province and where they could be used, and whether a flu clinic or for clinic to do testing. So it's a good thing that it's there for sure. I mean, I wish we didn't have to have one of these clinics at all, but yeah, that's.
Will there be one? The rumor has it there's one opening in Pierrefonds. Is that a fact?
I don't have any information on that, but I wouldn't be surprised they would be rolling out another clinic.
Okay. Homeless. What about the homeless in the West Island? There's no provisions for that yet.
Yeah, and there has been quite a few announcements lately for how they're going to help homeless, especially in downtown Montreal. But there has been an increase here in demand and questions about what we're going to do to the West Island, whether it comes from AJWA or other groups about youth. So it's definitely flagged, and we're paying attention to, and we brought it to our health board's attention. So keeping a close eye on it for sure. Whether those services and people could be brought downtown temporarily to the facilities are setting up here is something I'm sure that is being examined by not just the health board, but all the different homeless associations in the city of Montreal. But there's no doubt people are very preoccupied about anyone who right now, and again, can't just think of the homeless as necessarily someone chronic. People fall into situations now, particularly with the tough economic times, into a vulnerable situation. We have to make sure that we're keeping a very close eye on those people, and they're getting the proper, whether it be put up in a residence or again just closely monitored. We have a duty to make sure we take care of those people.
How do those people reach out to anybody? Where are they reaching out to?
There are some resources for sure. Of course, you can always come to myself, to Monsef, to Carlos, to Enrico, and write us directly, and we can put you into contact with the right resources. So I think that would be one way I could suggest to your followers, if they know of anyone, contact us, and we can try to give a hand to put them into communication with the right people.
Okay, that's great. Thanks for that. Landlords are, it's April 1st. It's no fool's joke today. What are the landlords doing with people not paying their rent? Because they still have to pay taxes and so on.
It's definitely going to be a challenge for this month, probably for the next month going forward. People who are renting, I mean, I can look at landlords. I can also look at renters who all of a sudden don't have an income or are waiting for that federal $2,000 to flow in, which is not something that can just be sent out overnight. So I know the Premier has asked for landlords to be patient and try to be flexible as possible, whether it's a deferred payment. And I understand they too have to pay a mortgage in some cases. So again, a situation that across the island of Montreal, we're watching carefully, people's ability to pay their rent, but also just people's mortgages, period. There's a lot of people who have been laid off, and for now, hopefully it's temporarily, but might be a little more long-term. how are we going to take care of those people who, especially, I think a lot of people in my generation who just locked themselves into a mortgage over long term. It's creating a lot of distress, and I'm not too sure, again, besides banks being compromising, is there a role the government could play, a larger role in trying to control mortgages and rents to help everyone out? It's something that has to be studied. But again, we have our caucus calls as a Liberal Party on 3 times a week, and my colleagues across the island of Montreal have raised it, and for all different levels, whether it's a landlord, renters, or people paying mortgages. So it's something that we're seeing volume on, people asking questions to us in our email boxes and on Facebook, and I'm quite worried. So it's something I think the government needs to address quickly.
Okay. I know it's probably not an answer and a question you can actually answer, but how long do you think we're going to be doing this?
That's a really hard question to answer. Look, I'll just go with what I've read from any group of experts. I mean, there's no doubt that we're going to remain in the same situation for all of April. It doesn't look like the curve that we're trying to flatten will flatten anytime soon. It probably, and hopefully best prediction is mid-April. So then after that, we're going to have to see, because we flattened the curve, but that doesn't mean the curve's going down. So we really have to wait until the curve starts decreasing, and then we can slowly retake our activities. I mean, I'm really hoping, Rhonda, that I'm able to go out in May to my parents' house, my family, have a barbecue, have a beer, and just enjoy those simple pleasures we take for granted, unfortunately, so often. But again, I kind of right now, my advice to everyone, let's just play this day by day and week by week, people, and listen to health authorities. The more we respect the washing the hands, the social distancing, the staying at home, the less spread of the virus will take place, and the quicker we can resume what we consider to be a normal life. And I'm really hoping that, again, we're looking at something like May, where we can start to slowly, let go of some of the restrictions and get back to maybe going to a restaurant, and maybe get back to, going to sporting events, things like playing in a league, go play a soccer game.
Basic stuff.
I'm hoping for that, but again, I'm just going to wait and really see and prepare myself to just, if I have to hunker down, I know by me staying in, I'm potentially preventing someone from getting sick and dying. And that's what this is really all about. It's not just ourselves. The less that we're out there, the less we're spreading the virus, and less of our friends, our family, our neighbors are getting sick. And that's why we're doing what we're doing right now.
And I've seen one meme go by, you're not stuck at home, you're safe at home.
Yeah, and honestly, that's an extremely good point. And I mean, there are obviously some, you still can go out to a store, you can still go for a walk. But again, even then, just go through the guidelines that the federal and provincial government have, and just being careful when you do that. There's nothing wrong right now with being a bit paranoid and being, cleaning too much. I've definitely gotten into the habit of wiping down things when I bring them back into my apartment. I'm taking no chances, washing my hands frequently. When I'm out here taking walks, because I still get out there and go for jogs, I really try to keep my distance, go to the other side of the street, stay away from people. I'm just doing what I have to do because I think that's the responsible thing right now.
Okay, and what will it look like when we reintegrate? Because celebration will come one day. How do we go back to normal?
It's going to be a really long time before I think we get back to what we considered normal. I can look on the health front that the virus won't disappear overnight. It might slow down, but it will still exist in the world. So until we have some type of vaccine, like a flu vaccine, that can really reduce the symptoms that you get from this and not overwhelm our hospitals, we might have to practice some social distancing for quite a bit. But maybe that's not a bad thing, that we're more aware of washing our hands, and at stores keeping our distance. Some things that maybe we kind of lost practices, which results in us always having a bad flu season. I'm happy to hear that the STM's wiping down our buses more frequently. I thought that was being done in the first place, and to learn it wasn't. So, maybe some of those practices will remain in place for a while, which is not a bad thing. But there's no doubt on the economic front, it's going to take a long time. It's really hard to predict anything right now with what's going on in the United States, which is the world's largest economy. How long are they going to be in the mud that they're in right now? It's concerning. But I just want your listeners, viewers, to know that, government can do what it can, and we'll work as hard as we can to get people back working and try to, return our society to some type of normalcy. But it might take a while. And again, we might just have to stick together through all this and look after our neighbors, for a very extended, long period of time. But I know our community, we're caring like that, and we'll get through this together.
We will. And thanks for coming out today and talking to us.
Yeah, no problem. And again, just to all your listeners, stay safe. You can follow me on my page, Greg Kelley M&A. If you have any questions specifically, we're doing our best to respond to everyone. We've had a lot of questions from businesses, a lot of questions from citizens, and we try to put you in touch with the right people in the government so you get the correct information you need. So don't hesitate on that front. And again, thank you, Rhonda, to doing a lot of activities to keep people entertained on your page, because you know, we got to sort of start creating content ourselves, because we're all just, but it's good to see, you know, local artists putting on shows. It's in some sense, in some ways, this pandemic has kind of brought people back together and maybe make attention to those things that are really important to us and to value them a little bit more. So I'm just trying to look at a few of the bright things that you can in this situation. But again, we'll get through it.
All right. Thanks so much for coming out.
No problem, Rhonda. We'll be in touch.
Or staying in, whatever. Whatever.
Take care and stay safe.
Oh.